every day I will get 70 OP. If you are waiting for 4 hours for me, it is not a means greatness, but autism cases are increasing more outside. Autism mothers are, so many mothers are suffering outside. Even though they are having a financially well settled, everything, అన్ని బాగుంది కూడా బాబుకి ఆటిజం ఉండేసరికి ఆ రెస్ట్లెస్నెస్ ఉండేసరికి వాళ్ళు దే ఆర్ నాట్ ఏబుల్ టు అప్రోచ్ టు ఎనీవే. సో ఇటువంటివన్నీ కూడా రేపు పొద్దున్న ఫ్యూచర్లో ఇంకా అంటే మనకు ఒక 30-40 years బ్యాక్ ఆటిజం వర్ నాట్ దేర్ ఇన్ ఇండియా బికాస్ దెర్ ఇస్ నో మెడిసిన్. మెడిసిన్స్ ఎప్పుడైతే మనం వాడడం మొదలు పెట్టామో, మెడిసిన్స్ ఎప్పుడైతే మనం ప్రెగ్నెన్సీ టైం మెడిసిన్స్ వాడడం కానివ్వండి, ఇప్పుడు చాలా మంది డ్యూరింగ్ ప్రెగ్నెన్సీ టైం ఆల్మోస్ట్ ఎవ్రీ మదర్ ఈస్ సఫరింగ్ థైరాయిడ్ ఆర్ anemic problem or diabetes problem. These are the main reasons. Autism, ADHD and hyperactive, these are the neurological disorder. These are the not diseases. Even hereditary గా వచ్చేవి కాదు. ఓన్లీ పేరెంట్స్ యొక్క హెల్త్ కండిషన్స్, స్పర్మ్ క్వాలిటీ తగ్గడం వల్ల, ఓమ్ క్వాలిటీ తగ్గడం వల్ల, మెడికేటెడ్ ప్రెగ్నెన్సీ వల్ల, ఇవన్నీ రేపు ఓవర్ వ్యాక్సినేషన్ వల్ల మనం జనరల్గా మన బాడీ చిన్నపిల్లలు 3 years లోపల 10 to 15 వ్యాక్సిన్స్ తట్టుకునే కెపాసిటీ ఉంటుంది. మనం 40 to 50 వ్యాక్సిన్స్ వేయడం వల్ల వాళ్ళ యొక్క ఒరిజినల్ ఇమ్యూనిటీ డిస్టర్బెన్స్ జరగడం వల్ల ఈ ఆటిజం, ADHD కేసెస్ విపరీతంగా పెరిగిపోతున్నాయి. సో చాలా మంది మదర్స్ సఫర్ అవుతున్నారు. అసలు వాళ్ళు చూస్తే నాకేంటంటే నేను ఎంతమంది చూడగలను, మనం ఎంతమంది చూసినా సరే ఇట్ ఈస్ వాళ్ళకి ఏదో ఒక సొల్యూషన్ గవర్నమెంట్ తరఫు నుంచి కావాలి. ఇప్పుడు చాలా మంది వేలూరుకి వెళ్తున్నారు, అక్కడ థెరపీ సెంటర్స్ అని చెప్పేసి సెంట్రల్ గవర్నమెంట్ థెరపీ సెంటర్స్ ఉన్నాయి అట్లా అని చెప్పేసి మైసూరు వెళ్తున్నారు. తెలంగాణలో కూడా ఆటిజం మదర్స్ కోసము ఒక థెరపీ సెంటర్ కింద ఓపెన్ చేయగలిగింది. ఎందుకంటే ఆటిజంలో 20,000 రూపాయలు పర్ మంత్ తీసుకుంటున్నారు బయట ఆటిజం థెరపీస్ కోసం. వాళ్ళు ఎంత డబ్బులు పెట్టినా సరే వాళ్ళకి 24 గంటలు మదర్ తోడుగా ఉండి వాళ్ళకి అసలు ఎంతో మంది అసలు ఆ సఫరింగ్ అనేది ఇట్ ఈస్ అవర్ రెస్పాన్సిబిలిటీ. సో తెలంగాణ గవర్నమెంట్ నుంచి హ్యావ్ టు ఓపెన్ ఆటిజం థెరపీ సెంటర్స్ ఓపెన్ చేయగలిగితే అట్లా ఇందాక మీరు చెప్పారు లైఫ్ స్టైల్ డిసీజెస్ అన్ని బికాస్ ఆఫ్ యూజింగ్ మోర్ మెడిసిన్స్ వల్ల మన ఒరిజినల్ ఇమ్యూనిటీ డిస్టర్బ్ అయిపోతుంది. పల్లెల్లో ఈవెన్ డాక్టర్స్ అయితే ఈవెన్ ఆర్ఎంపీ డాక్టర్స్ కానివ్వండి, నార్మల్ మెడికల్ షాప్స్లో కానివ్వండి, డైరెక్ట్గా యాంటీబయాటిక్స్ వాడడము వితౌట్ డాక్టర్ కన్సల్ట్ తోటి అసలు మెడిసిన్స్ వాడడం వల్ల వాళ్ళ యొక్క ఒరిజినల్ ఇమ్యూనిటీ డిస్టర్బెన్స్ కలిగి వాళ్ళ యొక్క స్పర్మ్ క్వాలిటీ కానీ ఓవం క్వాలిటీ కానీ డిస్టర్బెన్స్ అయ్యి అనీమిక్ మదర్స్ ఇప్పుడు అసలు ఫ్యూచర్లో ఇప్పుడైతే యంగ్
hospital, higher care center, so they go on just shift immediately in rush up. They will come for the small centers. Once patient is stabilized, they look set for the higher center. That may be the one reason, I think. But anyhow, you told very well. If any good suggestions are there, government is free. I understood. In fact, we are thinking for a single window system as we brought for industries. The young doctors like you, those who wants to start a nursing home, they have to go around for many permissions, GHMC permission, health department permission, fire department permission, pollution department permission. It will be definitely for a doctor going all around these government offices, getting permissions. I can understand there are some problems are there in the system, I should admit, but it's not that problematic compared with other states. But still, recently we started thinking to encourage एक single window system कोई बनाएंगे. So once you apply in that, all departments, the file will go in online only. They will give permission for the nursing homes. We are thinking on that lines. If any other issues also, you can feel free. I know after when you are talking, I am thinking that I should have a small meeting with small nursing homes. एक बार सबको बिठा के आपसे बात भी करेंगे. क्या problems you are facing? What government can give you relief in? How we can give? Very shortly, I will take a meeting with all small nursing homes.
That is great because the middle class people usually they don't prefer go to a government setup. At the same time, they cannot afford corporate this thing. And
But
they
now-
want to cater it. Sorry, I just want to finish this. Because they want to cater it, but financial sustainability comes into picture for a middle nursing home like us. We want to cater it, but at the same time, we cannot pay salaries or the rents if we have to give free.
Partially,
Is not there. Like you're saying, a lot of middle class people feel in Telangana, if you want for your club, everything starts getting done. Seriously, I am not at that right now. Very rich people anyway have all the options.
Yeah.
If you're middle class, so I want to agree.
Either they can't to government or they can't go to the corporate. Which may have it.
Yes.
So actually, partially I agree with her and you, but recently, slowly we started गवर्नमेंट में भी कॉर्पोरेट स्टाइल हम बना रहे हैं। अब मैं तो महीने हम जो व्हेन आई टेक रिव्यू विथ माय गवर्नमेंट डॉक्टर्स एंड टीम लीडर्स, मैं बोलते अपना कंपटीशन है प्राइवेट हॉस्पिटल से, ये नहीं कि गवर्नमेंट हॉस्पिटल में कंपटीशन है, लेट अस कॉम्पिटिट विथ कॉर्पोरेट। मैं वही हमारे लोगों को बोलते आ रहा हूँ, द फैसिलिटीज़ व्हाट दे हैव इन कॉर्पोरेट, वही मशीन मैं आपको दिलाता हूँ, वही इक्विपमेंट मैं आपको दिलवाता हूँ। आप उससे भी उनसे भी आप बहुत एक्सपीरियंस्ड है, बहुत एक्सपोज्ड है, यू ट्रीटेड मोर नंबर ऑफ पेशेंट्स, चलो आप भी काम करो बोल के मैं महीने पूछने लगता हूँ कितना सर्जरीज हुआ, कितना आप आर्गन ट्रांसप्लांट्स करे, कितना आप कैटरैक्ट करे। हर डॉक्टर को, हर डिपार्टमेंट को भी वी स्टार्टेड रिव्यूइंग। व्हेन वी टॉक टू देम देन नॉर्मली दे विल से सर मुझे माइक्रोस्कोप नहीं है, मुझे कैथ लैब में रिपेयर आया, या मुझे ये नहीं है वो नहीं, देन इमीडिएटली all HODs, my secretary will be there. I used to give the instructions. Next month again same date my review will be there. By the time the equipment will come, now equipment आ गया, क्या progress है. So we started with competing with corporate. In last 1 year, our surgeries in government hospitals have increased by 50%. 50% increase हुआ surgeries में. So ऐसा हम compete कर रहे हैं. अभी हैदराबाद में चारों तरफ 4 corporate hospitals भी ला रहे हैं, super specialty hospitals in government sector. अलवाल में एक ला रहे, एलबी नगर में एक ला रहे, सनत नगर में एक ला रहे, टिम्स गच्चीबोली में एक ला रहे। दिस 4 सुपर स्पेशलिटी हॉस्पिटल विद 4000 बेड्स आर कमिंग अप, एंड निम्स में भी कि हम एक 2000 बेड का अगेन 1 मोर सुपर स्पेशलिटी वी आर ब्रिंगिंग अप। अब तो ऐसे छोटे छोटे हॉस्पिटल्स तो हम ही कॉम्पिटिशन देंगे, तो हम ही कॉम्पिटिशन देंगे। नाउ माई आई कैन से नाउ वही बोल रहा था मैं, व्हेन आई मेट सम डॉक्टर्स ऐसे आउटगोइंग डॉक्टर से मैं बोल रहा कि अब भाई प्राइवेट नर्सिंग को मत रखो, आप हॉस्पिटल में हम अभी नोटिफिकेशन डाले, ज्वाइन हो जाओ गवर्नमेंट सर्विस में। रिसेंटली वी हैव गिवन ए नोटिफिकेशन फॉर 1400 असिस्टेंट प्रोफेसर्स। थोड़े डॉक्टर्स ऐसे मिले तो बोला मैं, अरे भाई नर्सिंग होम क्या लगाते, असिस्टेंट प्रोफेसर ज्वाइन हो जाओ, जल्दी जल्दी आपको प्रमोशन भी मिलता, प्रोफेसर भी हो सकते। यहाँ ज्वाइन होने के लिए मैं बोलना शुरू करा। मैं रिसेंटली आई ब्रॉट ए स्मॉल चेंज ऑल्सो कि गवर्नमेंट डॉक्टर शुड नॉट डू प्राइवेट प्रैक्टिस। So पुराने डॉक्टर्स को वी आर अलोइंग दोज हु आर ऑलरेडी रिक्रूटेड। नाउ फॉर फ्रेश रिक्रूटमेंट इन द रिक्रूटमेंट नोटिफिकेशन इटसेल्फ वी टोल्ड दैट नो मोर प्राइवेट प्रैक्टिस। या गवर्नमेंट में है तो पूरा गवर्नमेंट का सेवा करो, नहीं तो प्राइवेट में है तो प्राइवेट में ही सेवा करो। सो दैट उनका भी कंपटीशन कम होता, हमारा भी अच्छा सर्विस मिलता।
In fact, I remember when I was talking to Padmashri doctor who was retiring, he said, my heart breaks because the best hospital is government hospitals 30 years ago. Now it's difficult for us to get good doctors, the best. अब आप जो ये सब बात कर रहे हैं, I'm feeling so happy. In fact, it was one of my questions. But I mean,
at the government hospitals we are incentivizing through आरोग्यश्री। गवर्नमेंट हॉस्पिटल में आप सर्जरीज करें, ऑपरेशन करें या ट्रांसप्लांट्स करें तो उन लोगों को हम आरोग्यश्री में 30% ऑफ द कॉस्ट वी आर गिविंग एज ए इंसेंटिव टू द डॉक्टर्स। अभी इतना हो गया, ये हम शुरू करके इक्विपमेंट देने के बाद नाउ अंडर आरोग्यश्री वी स्पेंड अराउंड 800 to 1000 crores पर एनम। अब इसमें 50% गवर्नमेंट हॉस्पिटल्स को जा रहा। इसके पहले तो 10-15-20% ही आरोग्यश्री केसेस गवर्नमेंट हॉस्पिटल में होते थे। अब हम इक्विपमेंट दिए, मॉड्यूलर थिएटर्स बनाए, रोबोटिक थिएटर भी लाए हम गवर्नमेंट हॉस्पिटल में। सो स्लोली हम ऐसा इंप्रूव करने के बाद 50% ऑफ आरोग्यश्री मनी इज नाउ गोइंग टू द गवर्नमेंट हॉस्पिटल्स। उसमें 30% ऑफ द मनी विल गो टू द डॉक्टर्स एंड द टीम हु आर पार्टिसिपेटेड इन द प्रोसीजर।
Just one extra thing is you added Tifa also, right?
Yes, madam.
Tifa is an excellent service which cannot be done by a small doctor or a unskilled doctor. It is a very highly skilled radiologist only can do that. But I can suggest you, sir, when gynecologists are preparing, means when MD gynecology students are doing it, they are exposed to the ultrasound scan and Tifa scan. They themselves can do all these things.
Correct, madam.
Getting the radiologist
Correct, madam.
assistance.
You are right.
Yeah, and this is a very expensive diagnostic test.
So what Dr. Padmaja Garu said, once I went to Petalburg Hospital. वहाँ पर ANC चेकअप के लिए बहुत सारे प्रेग्नेंट वुमेन लाइन में लगे हुए हैं। मैं उनके मिल से बात करा, क्या भाई आप कब आए हॉस्पिटल को, कितने बार आए, कहीं प्राइवेट में गए क्या, पूरा स्कैनिंग टेस्ट यहाँ पर हो रहा नहीं हो रहा बोले तो देन वन प्रेग्नेंट वुमेन सेड सर एक स्कैन में ही बाहर करवाए, बाकी तो पूरा यहाँ करे, एक स्कैन बाहर कर। क्या है वो? टिफा स्कैन। मैं डॉक्टर से पूछा क्यों आप लोग ये नहीं कर रहे हैं? सर आपने हमारे पास ये हाई एंड अल्ट्रासाउंड मशीन नहीं है, या टिफा स्कैन इज़ रिक्वायर्ड फॉर एवरीवन। The doctor said, नहीं sir, 10-20% women only requires, but आजकल क्या हो गया, हर pregnant woman is taking a TFAS scan, routine हो गया. Then immediately I came to my office, called my secretary and had a meeting. I have ordered for 45 TFAS scans at a time. In every district now we set up with a TFAS scan. As Madam Padmaja said, वो रेडियोलॉजिस्ट हैदराबाद में मिलते, कोई डिस्ट्रिक्ट हेडक्वार्टर्स में मिलते, जहाँ पर तो मिरियालगुड़ा, सिरसिल्ला और भूपालपल्ली और सूर्यापेट ऐसे जगह थोड़ा कोतगुडम में रेडियोलॉजिस्ट मिलना मुश्किल है. एज राइटली सेड बाई डॉक्टर पद्मजा, हम क्या करें, गायनकोलॉजिस्ट को पूछे कि एमडी गायनकोलॉजिस्ट, दोज हु आर इंटरेस्टेड विल गिव ट्रेनिंग. पूरे गवर्नमेंट डॉक्टर्स को एक ऑफर दिए तो ऑलमोस्ट 45-50 आवर गायनिक डॉक्टर्स केम फॉरवर्ड. उन लोगों को हैदराबाद में निम्स में लेके आके, निम्स एंड कोटी मैटरनिटी हॉस्पिटल में एक हफ्ते का ट्रेनिंग देके उन लोगों को, नाउ वी आर यूजिंग गायनिक डॉक्टर्स टू डू दिस TFAS scans.
In fact, so many earlier years we have done research.
And I also review. Yeah, but
the best specialists to districts. That is also because all your plans are so deeply wound into the districts and the villages and the constituencies, and it has historically been difficult to attract good doctors to come there. So I'm sure you'll find a solution to that also. But
see, Deepalaji, you see, after 4 or 5 years, scenario will change completely. Of Telangana, last year we started 8 new medical colleges. This year I am going to add another 9 new medical colleges in our state. So when state has come, 20 medical colleges used to be there in our state. Today we have 46. I am going to add 9 this year. It will touch 55. 55 medical colleges in our state itself. So with that, what happened? Plenty of doctors will be coming out. When state has come, the seats were around 2,900. Today it is 7,000 plus. And next year means this August, this July, August, it will cross 8,000. More than 8,000 MBBS seats will be available in our state. So more doctors will come. Not only MBBS, now slowly we started PG seats, we started super specialty seats. Now PG seats we started in Nalgonda, Suryapet, Mahbubnagar, Siddipet. 55 PG seats in Nalgonda, 50 PG seats in Siddipet. Like we started adding PG seats, and super specialty maybe we doubled our seats in 7 years. So more doctors, more availability is very important. That's why we are focusing to start more and more colleges. Even private also we are encouraging. Whoever comes for a put up a private medical college, we are encouraging. We are not stopping anybody. Government we are doing in every district, as well as if any entrepreneur, if anybody wants to establish a private medical college in our state, government is freely encouraging.
So we are pharmacy and we can see increasing prices of drugs, all life-saving drugs, all.
That is completely controlled by government of India. Nothing is there in our hands. Hyderabad is a pharma capital. Hyderabad is a vaccine capital. Abhi Hyderabad medical में भी कैपिटल बन रहा. Now we are attracting patients from total Gulf, Globe, African countries. No, because अच्छे doctors है, अच्छे environment है हैदराबाद में, and the cost of the treatment is very less. Previously people used to go to US or UK for organ transplants. अभी organ transplants पूरा इंडिया में सबसे ज़्यादा हैदराबाद में हो रहा है. Every hospital is competing and they are successful. They are successful. 90% success rate is there in organ transplant. Our doctors become expert, both in government and private. Even in government we are doing completely free under Arogyasri. We give them 10 lakhs and lifetime medicine be free dete. Lifetime. So Gandhi is doing organ transplant, Usmania is doing, NIMS is doing, and private तो बहुत कर रहे. अपने हैदराबाद में इतने पेशेंट्स आ रहे, गल्फ, अफ्रीका, इवन पार्ट ऑफ एशियन कंट्रीज से भी बहुत सारे पेशेंट्स आ रहे अपने पास. सो हैदराबाद इज बिकमिंग ए हेल्थ हब, मेडिकल हब भी बन रहा है. फार्मा हफ्ता, आईटी हफ्ता, वैक्सीन हफ्ता, अभी हेल्थ हब भी बन रहा है.
Sir, what is the small solution, sir? In Arogyasri, why can't you include Ayurveda and homeopathy?
Yes, recently when वही हमारा कल इनॉग्रेट कर रहा था ना मैं, so my director asked me, sir आप तो इतना अच्छा पैसे दिए, अभी इनॉग्रेट कर रहे हैं, लेकिन इसको चलाना है हमारा को. सिर्फ प्राइवेट पेशेंट्स कितने आते कि नहीं कि आरोग्यश्री में ये इंक्लूड कर दिया तो थोड़ा भी हमारा भी रेवेन्यू आता बोलते इमीडिएटली आई टोल्ड माय सेक्रेटरी टू रन द फाइल वेरी शॉर्टली वी आर गोइंग टू डू दैट.
And sir, the word medical tourism has, in fact, if I'm not mistaken, started with Kerala promoting Ayurveda. If history has been back. So kindly include Ayurveda also in your dream things.
Sure, sure.
And let's create Telangana as a medical hub, including all the medical system, not only one system, multidisciplinary. Because going forward, I feel a collective system or integrated system is going to be the thing which is going to stay.
You're right. That's why now the 3 hospitals which I started, now I made it part of medical college. See, Vikarabad, that 600 bedded medical college and this 50 bedded Ayush are both are in one premises. So that where you don't get treatment, you can be treated here. If you don't get treatment, you or both can go together. So that's why this 50 bedded, this first time we started 50 bedded Ayush hospitals. It's not that Ayush में फिर एक ही नहीं, पूरे लोग मिलके 50 बेडेड में यूनानी डॉक्टर होगा, आयुष डॉक्टर होगा, वहाँ पर यू विल हैव ए होम्योपैथी डॉक्टर, ऑल डॉक्टर्स विल बी देयर to treat that in that 50 bedded Ayush hospitals. And I made it part of the medical colleges, both in all 3 places, Siddipet, Vikarabad and Bhupalpalli. If it is successful, in future we will repeat this.
Last point, sir. Yes. So just educationally, you strengthen the nursing colleges and paramedics also, sir.
Absolutely, madam.
Many number of medical colleges are coming.
Correct, madam.
Shortage of paramedics.
No, already we have taken decision, madam. We are starting a nursing college along with every medical college. Already 8 nursing colleges have been sanctioned and the students have joined already. It's not 8. In future, in all the 33 districts, we will be having nursing colleges. Even in paramedical, we are going even little advanced. Paramedical, not just lab technician. Now, we have decided for BSc paramedical में स्पेशलाइजेशन, ICU BSc पैरामेडिकल, वो आर्थो में स्पेशलाइजेशन, कार्डियो में स्पेशलाइजेशन, किडनी ये डायलिसिस में पैरामेडिकल स्पेशलाइजेशन. सो रिसेंटली आई हैव सैंक्शन. सो व्हेन माय फाइल वाज केम टू मी, आई सेड पूरे एक ही सिस्टम में लगाया हमारा लोग. देन आई सेड भाई थोड़े कॉलेजेस में थोड़े कोर्सेस लगाओ, थोड़े कॉलेज में थोड़े कोर्सेस. सो इन एवरी मेडिकल कॉलेज इन फ्यूचर वी विल हैव MBBS, nursing and paramedical college. In all the 33 districts we will have doctors के साथ this paramedical staff and nursing staff is equally important. We have recognized that, and we also decided to go for only BSc nursing, not the general nursing. 4 years nursing course we are encouraging now, because not only in our state, in outside also they will have future. If they go out also for foreign countries, this 4 years BSc nursing will definitely help them in getting employment and giving good service.
After Telangana formation, only one homeopathic college is. So you're not.
See, students are not joining. Recently, I went for attend a college day, some homeopathy college in Mulugu of Siddipet district. That management was saying, sir, people are not joining. Then what can I do? If students show interest, we can open more colleges. In the existing colleges itself, children are not joining.
It's only one college of this, sir. In Andhra, 3 colleges. Yeah.
I'm ready. When I'm opening 33 MBBS colleges, why not a 1 or 2 homeopathy? But students should join. See, for private medical, in private homeopathy colleges also, 50% seats are reserved for government. 50% seats will be given free of cost. So their children are not joining. So ultimately, we should look. It's a BDS courses. What happened? Now nobody is joining in BDS. Many BDS doctors, they're roaming around.
Sir, one question.
The last note because minister has to.
Yeah.
What's the time?
Yes.
Time.
Sir, one last question, sir. మీరు అన్నారు కదా ఏంటంటే మేమే కాంపిటీషన్ వస్తాము సో యువర్ గవర్నమెంట్ so why can't you include us also in your government scheme? Please give us some schemes for the private small sectors also so that we can also survive. మీ విజన్ మీ డ్రీమ్ చూస్తుంటే మాకు భయం ఇస్తుంది. So you should include us also in your dream and take care of us also. That is
Sure, we'll think, Antama. We'll try to make you part of Arogyasri. We'll try to extend employees' health insurance scheme, journalists' health insurance scheme, so that you can treat employees, journalists, and the people where you get reimbursed from government. We'll definitely discuss and we'll utilize your strength also.
See, I think we can talk to him for 5 hours, 10 hours. But now he has other plans, so he would like to visit sometime. I request Kamal to Abbas to please give me a request to all the doctors. I really thank you for your honest share.
Thank
you. They just said what they are experiencing in life. And I knew that when he would come, whatever he would say would make everyone happy because he's so much in touch with people, he knows what they're talking about. I don't have to tell him, he knows. But it's good, all the doctors should tell him. And so every year you have to come and tell us now what is next, because I think this is one topic. See, we do so many things, we do healthcare, we do
So I also appeal with Times of India. This CPR program you need to promote. So little education. See, only 5% of people knows about CPR. In India, around 4 to 5,000 people are dying due to sudden cardiac arrest every day. Every day, 4 to 5,000 people are dying. If people are have awareness, we can save 50%. We can save 50% of them. So at least out of 5,000, we can save 2,500 lives every day. Now we started training all the municipal staff, police staff, health staff, Panchayat Raj staff and apartment associations, gated communities, security staff. We are trying to train them and we are making a law to have a AED equipment. If with this CPR, if doesn't respond, a mild electric shock will be given from the top of the chest. With that also revival will happen. So we are trying to bring some act also for all gated communities, apartments. You should have compulsory an AED to get the permission and train भी करते जा रहे हैं, awareness भी लाने के लिए हम कोशिश कर रहे हैं. इसमें जरा टाइम्स ऑफ इंडिया का भी कोऑपरेशन चाहिए. ट्रेनिंग we have decided GHMC all colleges में जाके दे रहे, every slum में भी जाके दे रहे, colleges में जाके ट्रेनिंग दे रहे. आप बोले तो एक दिन टाइम्स ऑफ इंडिया ऑफिस में ट्रेनिंग लगा के पहले आपका स्टाफ को ट्रेन करते हैं. हर जिले में भी कर रहे. आप एक दिन बोले तो यहाँ पर कंटी वेलुगो का कैंप लगा के आप लोगों का आईबी टेस्ट करेंगे. एक दिन आपके पूरे रिपोर्टर्स को, स्टाफ को यहीं पर सीपीआर ट्रेनिंग हम दे देंगे. एवरीवेयर वी आर ओपन नाउ. वी आर गिवन एन ओपन ऑफर. कॉल नंबर भी दिए हैं. सो कॉल करें तो जाके हम ट्रेन करना शुरू कर रहे हैं. सिर्फ ओनली 5% ऑफ पीपल नोस दिस.
Even if you go to a corporate office and suddenly something happens in office, nobody knows.
Nobody knows. आप एम्बुलेंस को कॉल करें, वो आए, दवाखाना गए तक 30 मिनट्स होता, 30 मिनट्स में ब्रेन डेड होता. You cannot revive the patient. Only 5%.
Very critical.
Only 4-5% are getting revived.